Hey, this is Dan Blewett. It's August 17th, so I guess day 11 of my second Tommy John surgery recovery. There's been some new things going on this week. As of day 8, they unlocked my brace, not fully, so I have now 105 degrees flexion and 30 degrees extension, so I can get all the way out to there, and then clicks right there. So as I walk around, I have a lot more, you know, comfortable ability to move, and I'm still supposed to limit use to my hand, so I'm not really grabbing stuff too much. I just kind of leave all the squirrels around. Don't pet them. They said just wait till week 3 to pet strange animals. But it's really nice having more range of motion. When I take the brace off, I'll show you. I have actually really, as of day 8 or 9, I have pretty much full extension of my elbow and passive range of motion, which is pretty exciting. I'm not supposed to be actively doing it, but as I really relax my arm and extend, I'm pretty much all the way there, and there's no pain, no discomfort. Swelling is really minimal. I can get comfortably right here with flexion, but I don't, I'm not going to push it here on camera. Just want to kind of fill you in what's going on. My scars are healing up. They're really kind of itchy with the stitches, but I'm getting them out on Monday, and it's Friday afternoon right now. I'm not gonna pull this off because it really looks about the same as it did the other day. But like I said, swelling's going down. Everything's feeling really good. I've been doing a lot of left arm, left side body exercises in the gym. And they said you can do what you want with your left arm, but you can't sweat because you don't want to get in the incision. Now my incisions are closed by now, but even then I'm not gonna do anything they tell me not to do. So I have a follow up on Monday, and if they clear me to exercise, I will. But until then, I'm not going to. So I've been doing left arm exercise. Well, to be clear, I take really long breaks in between sets, so my heart rate doesn't get up. I'm not sweating. It's a nice air conditioned gym, and just doing a unilateral pushing. I think we talked about this the other time. That's been going really well. I don't know. I sort of attribute that to my success with my right arm so far. Looking back at my first surgery, I reported that I had full range of motion as of 3 weeks. I don't know if that included full flexion because I don't have full flexion right now, but I do have full extension, at least passively. And so it looks like I'm doing well. Obviously, I don't want to be the king of Tommy John rehab. It's like, the movie Bull Durham. He's Kevin Costner's character doesn't want any acclaim for being the minor league home run king. Dubious honor. I understand. I don't want really to be the best at recovering from Tommy John surgery, but at the same time, I'm happy that I'm doing well the second time. Anyway, hand strength's getting a lot better. Rehab's getting a little more complex. I can do isometrics now with my trainer, so we do tricep extension and bicep curl. So she'll resist my arm as I flex against it. We do different spots in the range of motion, just isometrics. A couple sets of 10 to 15 second holds, and then we do 6 ways of the forearm. So pronation, I resist pronation, resist supination, wrist flexion, wrist extension, ulnar or radial deviation, and ulnar deviation. So that's kind of the next stage of rehab right now. Just slowly moving forward from just the squeezes and kind of hand weight exercise. I'm still doing all that stuff, but like I said, we're progressing. So I haven't really looked at the sheet. I'm not sure what next week entails, but like I said, I'm seeing the doctor in a couple days and then driving back home. Been shifting my car with my left hand. They said I'm clear to do my manual transmission whenever I can do it pain free, but I don't really want to try it, I think, until at least another week. I don't have any pain walking around, but at the same time, I'm fine doing my left arm, so that's how I've been getting around. And I guess as far as mentally, I really enjoyed my meditation sessions this week. It's keeping me close to the game. Last time I got really far away from it, and just seeing myself on the mound. I've been in touch with a healer. Her name's Pat. She's a super sweet woman, and she sends me energy from She actually lives in Florida right now, and so we've been talking a little bit. And I don't know how I feel about that, but at the end of the day, she's super positive, and she believes, she sees me healing well. She's sending me healing, and my arm's doing great. I believe in a big mind-body connection. Obviously, I saw big results with it this year, pitching, and I just can't imagine that there can't be some positive effect from, whatever she's sending me, whether it's truly, invading my elbow and helping, the molecules to fasten, but maybe it's just, positivity and affecting me mentally, which affects my arm positively. Obviously there's stories out there about cancer patients recovering, seemingly from their sheer will and determination. And like I said, I believe in the mind-body connection. I really can't, obviously you can't measure it, it's sort of intangible, but I feel very stress-free and positive with my meditations, and like I said, seeing myself in game situations, seeing myself do the things I want to be doing, exercise-wise, throwing-wise in my head, to where hopefully my body's not going to forget. I'm going to have better feel for my off-speed stuff when it comes back, 7 months from now. All those kind of things, where if I can stay close to the game and really feel like I'm still a part of it mentally, hopefully my body will remember, all right, there's the curveball, and it won't take nearly as long to get it back, sharp and effective as it did last time. Because last time, I got my velocity back, in between 9 and 11 months, but it took a really long time to get my feel for my breaking stuff and my change up. So hopefully a strong connection with, visualization and my in-game performances throughout this process will hopefully lessen the time that it'll take to get that stuff back. So anyway, that's I guess that's my update. I won't drag these out too long, but I guess moral of the story is got some more range of motion, no longer in the sling. Pretty excited about that, and really just things are coming along, just crying it out. So another update probably maybe 4 or 5 days from now when I'm in week 3 and kind of get a handle of what I'm doing. So all right, thanks.